Pretty much all of us will develop an element of chronic kidney disease as we get older. It's normal as we age, but the rate of the decline is what we care about from a longevity perspective. And there are signs that you should definitely be aware of. Most people don't think about their kidneys until something goes catastrophically wrong. They're just these two bean-shaped organs tucked away in your back that you learned about briefly in school and then probably forgotten. But your kidneys are doing something extraordinary every single day. They're filtering about 200 L of blood. They remove toxins, they regulate fluid balance, they maintain electrolyte levels, produce hormones, and keep your entire system in equilibrium. And when they start to fail, your whole body begins to fall apart. The tragedy is that early kidney disease is largely preventable and manageable if caught early. But most people don't catch it early because they don't know what to look for. The symptoms are subtle. They're easy to dismiss, and by the time they become obvious, significant damage has already occurred. I'm Dr. Lauren Hayes. I'm an emergency medicine doctor, and I've spent the last decade or so watching people arrive in the emergency department with kidney failure that could have been prevented. When we reviewed their medical history, the warning signs on the most part were always there. The clues were present for months or years, but nobody connected the dots. Nobody recognized that persistent fatigue or foamy urine or unexplained swelling weren't just normal parts of aging or stress. They were early distress signals from failing kidneys. So today, I want to change that for you. We're going to walk through 7 early warning signs that your kidneys are struggling. I'll explain what's actually happening at a physiological level, why each sign matters, and how to distinguish normal variations from symptoms that need medical attention. Because knowledge is the difference between early intervention that preserves your kidney function and late-stage crisis management that dramatically limits your options. Your kidneys can't speak to you directly, but they are sending signals. So let's learn how to read them, what your urine foam is telling you. So let's start with that bathroom observation that most people seem to ignore. And we all get this to a degree, which is foamy urine. So occasional foam when you urinate into the toilet is normal, especially if you're dehydrated or urinating forcefully. But persistent foam, foam that doesn't dissipate quickly, foam that looks similar to what you'd see with dish soap is a red flag. And it's pretty common. This is a marker of proteinuria, the presence of significant protein in your urine. And here's what's happening at a kidney level. Your kidneys contain about 1 million filtering units called nephrons. Each nephron has a glomerulus, which is essentially a bundle of tiny blood vessels with a sophisticated filtration membrane. This membrane is designed to let small molecules and waste products through while keeping larger, more valuable molecules like proteins in your blood. When your glomeruli are healthy, almost no protein makes it into your urine. But when these filtration barriers become damaged, whether from diabetes, high blood pressure, inflammation, or other causes, they start to leak. Proteins, particularly one called albumin, pass through into the urine. These proteins then act like soap when you urinate, creating foam that persists. The presence of protein in the urine isn't just a marker of kidney damage. It actually accelerates the problem even more. Proteins in the tubules of the kidney trigger inflammatory responses and oxidative stress, creating this vicious cycle. The challenge is distinguishing normal occasional foam from pathological proteinuria. If you notice persistent foam most times that you urinate, particularly if it's accompanied by any of the other symptoms that we'll discuss, you need to see your doctor for a blood test and a urine test. A simple dipstick test can detect protein, and if it's positive, then a 24-hour urine collection can quantify exactly how much protein you're losing. Early detection and early treatment of proteinuria can significantly slow the progression of kidney disease. Why your ankles are swelling. Moving on to the second warning sign, something that many people attribute to standing too long or hot weather, but actually can signal kidney dysfunction, and this is ankle swelling. We know from clinical studies that edema, which is the medical term for swelling, is often one of the first visible signs of kidney problems. The mechanism here connects to what we just discussed about protein loss in the earlier point. Your kidneys, when they're damaged, don't just lose their ability to filter waste, they also lose their ability to regulate fluid balance and maintain protein levels. As protein leaks into your urine, your blood protein levels drop, and this creates a problem called hypoalbuminemia. Albumin in your bloodstream creates what's called oncotic pressure, which helps to keep fluid inside your blood vessels. When albumin levels fall, this pressure decreases and fluid leaks out of your blood vessels into the surrounding tissues. Now, gravity pulls this fluid into the lower extremities, which is why you see swelling in your ankles and feet first. As kidney function worsens, the swelling can progress to your knees, to your thighs, and eventually affecting your hands and your face. Now, there's another mechanism at play here. Damaged kidneys don't excrete sodium efficiently. Sodium retention leads to water retention because water follows sodium. This increases your total body water, contributing further to edema. The kidneys also produce hormones that regulate blood pressure and fluid balance. And when these systems are disrupted by kidney damage, fluid retention worsens. What I would say is this: occasional mild ankle swelling after a long flight or a day on your feet is perfectly normal. But persistent swelling that doesn't resolve with leg elevation, or swelling that's worse in the morning, swelling that pits when you press on it, meaning it leaves an indentation. These are concerning signs that warrant investigation. A simple blood test for albumin and a urine test can start to clarify whether kidneys are the cause. The fatigue that doesn't make sense. Moving on to number 3, and this is something that's really easy to dismiss because it's so common and has so many potential causes, and this is fatigue. But when fatigue is related to kidney disease, it has specific characteristics that set it apart, and it's driven by a specific mechanism, CKD-related anemia, which has been extensively documented in the New England Journal of Medicine. So your kidneys do more than just filter waste. They produce a hormone called erythropoietin, or EPO, which signals your bone marrow to produce red blood cells. When your kidneys are damaged, EPO production drops. Now, with less EPO, your bone marrow produces fewer red blood cells, and you become anemic. Anemia means less oxygen carrying capacity in your blood, which means less oxygen delivery to your tissues, your muscles, and your brain. And this creates a type of fatigue that's profound and persistent. It's not the tiredness that you feel after a bad night's sleep that improves with a coffee. It's a really deep exhaustion, a heaviness that makes even simple tasks feel overwhelming. You might find yourself needing to rest after activities that used to be easy. You might have difficulty concentrating because your brain isn't getting optimal oxygen. You might feel short of breath with minimal exertion because your body is trying to compensate for reduced oxygen carrying capacity. What makes this really insidious is that anemia develops gradually as kidney function declines. You don't wake up one day suddenly anemic. It creeps up on you, you adapt. You tell yourself that you're just getting older, or you're a bit stressed, or you need more sleep. By the time this anemia is severe enough to prompt testing, significant kidney damage may have occurred. Now, the diagnostic workup is pretty straightforward. A full blood count, which is probably the most common blood test that we do, that will show anemia, typically characterized by a low hemoglobin and a low hematocrit. And then further testing can confirm that it's not an iron problem, that there's no bleeding, and that the anemia is indeed related to reduced EPO production. Once identified, CKD-related anemia can be treated with EPO injections or newer medications that stimulate EPO production, but the underlying kidney disease still needs to be addressed to prevent further decline. The nighttime bathroom trips, nocturia. Moving on to number 4, and this is something that worsens progressively as kidney disease advances, which is nocturia, the need to urinate frequently during the night. Now, research published in the American Journal of Kidney Disease identifies nocturia as an early symptom of chronic kidney disease that's often overlooked. Healthy kidneys concentrate urine during your sleep. Your body produces antidiuretic hormone, or ADH, which signals your kidneys to reabsorb more water and produce less urine at night so you can sleep uninterrupted. Your kidneys respond by producing small amounts of highly concentrated urine. This is why your first morning urine is typically darker and more concentrated, and maybe a bit smelly compared to urine during the day. When kidney function declines, this concentrating ability is lost. Damaged tubules can't respond properly to ADH signals. They can't reabsorb water efficiently. The result is that your kidneys continue producing dilute urine throughout the night, and your bladder fills repeatedly, waking you up to urinate. This isn't the same as drinking large amounts of fluid before bed or having an overactive bladder. It's a fundamental loss of the kidney's ability to regulate fluid balance according to circadian rhythms. The other mechanism involves the kidney's ability to handle the waste products and excess fluid that accumulate during the day. When the kidneys are struggling, they may take longer to process and excrete these, leading to increased nighttime urine production as they work to catch up. Now, some people with early kidney disease find that they urinate more frequently during the night, but produce less urine overall during the day. The pattern to watch for is progressive worsening. If you're waking once per night to urinate and you're over the age of 50, then that's relatively common, and it's not necessarily concerning. But if you're waking 3, 4, maybe 5 times per night, if this pattern has developed relatively recently, if the nighttime urination is producing large volumes, then these are signs that warrant evaluation. Urinalysis, blood tests, and potentially even more detailed kidney function tests can clarify what's happening. When your eyes look swollen. Now, number 5 is related to the fluid retention that we discussed earlier, but it manifests in a specific way, which is puffy eyes, particularly in the morning. Now, there's plenty of research that's documented how periorbital edema, which is swelling around the eyes, is a clinical sign of kidney dysfunction related to protein loss and fluid retention. The skin around your eyes is among the thinnest and most elastic in your body, which makes it particularly susceptible to showing fluid accumulation. When you're losing protein through your kidneys and your blood albumin level drops, fluid doesn't stay in your blood vessels as effectively. During sleep, when you're horizontal, this fluid distributes evenly rather than pooling in your lower extremities. The loose tissue around your eyes readily accumulates this fluid, creating puffiness or swelling that's often most noticeable when you first wake up. The pattern is typically bilateral, affecting both eyes symmetrically. If only one eye is swollen, then that's more likely to be a local problem like an infection or an injury, which is really worth getting seen straight away. The swelling usually improves somewhat as the day progresses and you're upright, allowing the fluid to spread downwards. But as kidney disease progresses, the periorbital swelling may persist throughout the day and be accompanied by swelling in other areas. The differential diagnosis here is really important because not all puffy eyes indicate kidney problems. Things like allergies, lack of sleep, crying, and, aging itself can all cause periorbital swelling. The key is to look for other concurrent symptoms and risk factors. If puffy eyes are accompanied by foamy urine or ankle swelling or fatigue, or if you have other risk factors like diabetes or hypertension, kidney disease moves much higher on the list of possibilities and warrants investigation. The muscle cramps. Nobody can explain. Number 6 is a symptom that seems completely unrelated to kidneys at first, but is actually a direct consequence of their regulatory dysfunction, and this is muscle cramps. Studies show that electrolyte imbalances from kidney disease commonly manifest as muscle cramping. Your kidneys are responsible for maintaining precise electrolyte balance, particularly sodium, potassium, calcium, magnesium, and phosphate. These electrolytes are critical for muscle contraction and nerve signaling. When kidney function declines, the ability to regulate these electrolytes becomes impaired. Levels can become too high or too low, and the balance between them shifts. Muscle cramps occur when there are rapid involuntary contractions that won't relax. And this happens when the electrical signals that control muscle contractions become disrupted, which electrolyte imbalances directly cause. Low calcium makes muscles hyperexcitable. Low magnesium impairs muscle relaxation. High or low potassium disrupts the normal nerve and muscle electrical activity. Now, the kidney's failure to maintain proper levels of these electrolytes creates the perfect storm for cramping. The cramps associated with kidney disease tend to be more severe and more frequent than typical exercise-related cramps. They often occur at rest, particularly at night. They may be accompanied by other symptoms of electrolyte imbalance, like weakness, an irregular heartbeat, or numbness and tingling to the fingers. The diagnostic approach involves checking a comprehensive metabolic panel to measure electrolyte levels along with kidney function tests. The treatment depends on which electrolytes are out of balance. For people with kidney disease, managing electrolytes often requires dietary modifications, supplements, or in advanced cases, dialysis to remove excess or replace deficient electrolytes artificially. The itch that won't go away. Now, number 7 is perhaps the most unsuspected kidney symptom of them all, something that seems to have nothing to do with kidney function, but is actually well documented in kidney disease, and this is itchy skin. So Kidney International has published extensively on uremic pruritus, itching caused by kidney failure. The mechanism is really complex and multifactorial. As kidney function declines, waste products that should be filtered out accumulate in your bloodstream. Some of these waste products are deposited in your skin where they trigger inflammatory responses and itching. Parathyroid hormone levels rise in kidney disease as the kidneys fail to activate vitamin D and properly regulate calcium and phosphate, and elevated PTH is associated with itching. There's also a component related to dry skin here. Kidneys regulate fluid balance, and as they fail, skin can become dehydrated despite overall fluid retention elsewhere in the body. Dry, dehydrated skin is more prone to itching. As well as that, the metabolic disturbances of kidney disease affect nerve function, potentially causing neurogenic itching, where the sensation of itching occurs without any visible skin changes. What makes uremic pruritus particularly distressing is that it's often resistant to typical treatments for itching like antihistamines or moisturizers. The itch can become severe and constant and debilitating, affecting sleep and even quality of life. It tends to worsen as kidney disease progresses and often doesn't fully resolve until kidney function is improved through dialysis or even transplant. The pattern to recognize is itching that's widespread, not localized to a rash or a bite. Itching that persists despite treatment with over-the-counter remedies. Itching that's worse at night or interferes with sleep. Itching that's accompanied by any of the other kidney symptoms that we've discussed. If you have unexplained persistent itching and risk factors for kidney disease, then testing your kidneys is essential. How to interpret these signs together. Now, the common thread through all 7 of these warning signs is that they represent different aspects of kidney dysfunction manifesting in observable ways. Foamy urine shows that you're losing protein through damaged filters. Ankle swelling and puffy eyes show fluid regulation has failed. Fatigue reflects anemia from reduced EPO production. Nocturia demonstrates the lost concentrating ability of your kidneys. Muscle cramps signal electrolyte dysregulation. Itching indicates waste accumulation and metabolic disturbance. None of these symptoms in isolation guarantees kidney disease, so don't be too concerned. And having 1 or 2 doesn't mean that your kidneys are failing, but they are signals worth paying attention to, particularly if you have risk factors like diabetes or hypertension or family history. The earlier that kidney disease is detected, the more opportunity there is to slow it down, to prevent complications, to maintain quality of life, and even extend your life. The tragedy is that most people ignore these warning signs until they've reached advanced kidney disease or until they're facing dialysis or even transplant. At that point, you're simply managing the disease, you're not preventing it. But if you catch these signs early, if you investigate them properly, if you work with your doctor to address the underlying causes and implement protective strategies, you can potentially preserve your kidney function for years or decades longer than if you wait until symptoms become severe. You now know what to look out for. You know what these symptoms mean at a physiological level, and you know that your body is constantly sending signals about its internal state if you know how to read them. The question is whether you'll pay attention, whether you'll take these warning signs seriously, whether you'll act on them before damage becomes irreversible. Your kidneys can't speak to you directly, but as with every other organ, they can send you signs and it's worth listening to them.